And
I
that
just want to ask something for people that aren't medical. What is the difference between a 1 hour surgery and a 3 hour surgery for the
yes.
patient?
Well, what is that?
Oh, it's huge. So the way I think about it, nothing good happens in the OR, right? You're under anesthesia. A machine's breathing for you. You're basically physiologically dying, and anesthesia is preventing that. And on the one hand, pharmacologically, physiologically, I don't want you under anesthesia. Number two, especially with the more open surgeries, the more soft tissue exposure there is, that's more time for bacterial contamination. That's more blood loss. That's more fluid transitions. And not for nothing, if you're spending that much time doing a surgery, there's only so much disc, there's only so much bone that you can see and move around. And so what that means is you're moving a lot of instruments in and out.
Mm-hmm.
And every time an instrument goes in or out, that's a chance to hurt something, pull something, damage something. Then the probably the biggest issue is retractor time, right? So it's become very clear that on all of these procedures, the number one variable that drives nerve pain, nerve injury, neuropraxia is how long the retractor is in place. How long is that nerve pushed over, pulled over, twisted, whatever, however you want to visualize it. And so it's no one of those things that makes a quicker surgery better. It's all of them. Yeah. And it's a synergy. It's not 1 + 1 + 1 = 3. It's 1 + 1 = 4. 1 + 4 = 7, because it's cumulative to the body.
And it's amazing, Will, you're just reciting the statistic right now. And this is a study based on almost 400,000 patients. Just the time under anesthesia, independent of kind of surgery, is an independent factor of morbidity, mortality, complication, and so on and so forth. And that relationship is practically up to 3 hours linear. After that, it becomes exponential.
It's exponential, yep.
Especially in elderly, defined 75 years and older. As a matter of fact,
absolutely.
This odds ratio is that every additional half an hour under anesthesia adds 17% to the combined risk of the surgery. And surgeries that are less than 2 hours, if you put them in one group, surgeries that are more than 2 hours in another group, you're doubling complication. And that truly upsets me.
And that's only major complications. That doesn't include delayed mobilization. That doesn't include late DVTs, all the other stuff that comes along with laying around. And it's funny, I got suckered in to a trick question by one of the foot and ankle surgeons, and it always stuck with me. He said, I think we were doing an ankle fracture, and he said, so what is the ideal tourniquet time for a bimal ankle fracture?
0.
You know? Exactly. I'm like, well, you really want to be under 25 minutes, right? And he goes, no, 0 is the ideal time. Nobody can do that, though. And it's funny you say that, because that stuck with me, that, you know, why would I do something that just that extends the time of whatever we're doing? And then obviously there's financial and logistical concerns as well, but the real issue is patient safety and outcomes.
Yeah. And, you know, and truly upset me when some of our colleagues, still in 2022 or 23, I don't believe the change of year has changed their mind. They think time doesn't matter. I mean, you need to talk just to the random anesthesiologist. As a matter of fact, I have conversation with anesthesiologists where they say on the camera what it makes from their side to extubate the patient, especially larger patients
absolutely
have comorbidity. But it is amazing to me that they look at the sky and they say the sky is green, where sky is blue.
Right.
Anesthesiologists can tell you that longer anesthesia directly impact And then when they cannot compete, when they cannot have argument against that, then they say, but you're rushing the surgery is dangerous. And
so I think you're hitting the nail on the head there. There's always two sides to every explanation, right? And I always look for which of the explanations is self-serving. And if you've got a surgeon's ego and you've got a surgeon's mentality, if I'm doing something in an hour, that makes it easy. If I do it in 4 hours, man, that was a real surgery. That was complicated.
Yeah.
Right?